Hi, Jamie.
Hi.
Thanks for taking some time to talk with us today. I first met you a little over 5 or 6 months ago, and at that time, tell me what your headaches were like.
I had a constant baseline headache, just always with me, carried it with me, to the point of almost not noticing it because it was just carried with me. It was just heavy. And then I would have migraines, stress headaches, up to about level 7, at least twice a week, 2 or 3 times a week. And they would last for days, and I would be in bed for days.
Right. So the baseline headaches, as I look at your notes, were around a 4, 4 out of 10, and then it would go up to 7 or above for at least half a week, every week sometimes. And you were on a whole bunch of different medications for your headaches as well as medication for other reasons, right?
Yeah.
And had been on many medications in the past, okay?
Yes.
So we then saw you and treated you with Botox, and you had a good result.
Almost immediately.
Yeah, and your headaches got significantly better. And so ultimately we released 4 nerves in the back of your neck, and that was a little over 4 months ago. What was the surgery procedure like, and the first few weeks or days afterwards? Tell us a little bit about that.
It was really a lot more simple than I thought it was going to be, and a lot less painful. It was just sort of the touch, and you do get a funky haircut out of it. But it took about a month to really heal, and but even during that time, the headaches were diminished. Okay. Even though I was healing and I had pain back there from that, it was less even than the headaches.
Okay.
And now that it's healed, the surgery itself was very easy. People at the hospital were super friendly and helpful. Okay. It went quicker than we thought it would.
Yeah.
And
now the hair has grown back, right?
Yes.
Okay, so that's good. And you're a little over 4 months after surgery. Overall, how would you say you're doing percentage-wise?
I am doing 75 or above. And I'm saying 75 because I know I still have just a little bit more healing to do. I have a feeling I'll be, looking at 90 to 100 pretty soon.
Okay. And so let's talk about some specifics. When I asked you before, how often are you getting a headache now?
I would say maybe once a week.
Okay, so from every day, all day, to once a week.
Yeah, the annoyance headaches, the 4s.
Okay, and so even those are only 4 out of 5 when you get them.
Right.
The medicines that you were taking, you were on the Subutex, which is a narcotic, and has your use of that gone down?
Yeah, we've actually cut that in half now.
Okay.
And are working on cutting it even less. Eventually, the goal is to just be completely off.
Okay. How about your Flexeril? You used to take that quite a bit.
Yeah, for muscle relaxation. I would say that's been cut even down to a third of what I used to take.
And then the Migraine, which you used to take when you got a really bad headache, it's now only that you've cut that down by a third as well, is what
Correct.
You said.
Yeah.
Okay.
Yeah, and that's because I'm not getting these nasty tension headaches anymore. I'm getting my true migraine. I've always had true migraines, and they would come once or twice a year, And so the Migraine works with a true migraine, and so I use it, and it works, and the migraine goes away.
So the Migraine has been more effective than it has in the past.
Right.
Okay, so overall, you're able to do more things, I guess, than you were before.
Oh yeah. I'm excited about new projects. Actually can talk to my kids and stand the sound of their voice. You get to that point where you just don't want to hear anything, just leave mommy alone, and so I'm a much better mom now.
Great.
I'm a much better wife now.
Great.
And I'm looking forward to just continuing on to just good health, losing this weight.
Perfect.
Yeah.
All right, well, thanks for talking with us.
Sure.